Hi, this is Jeff Zeig with today's 5-minute video. In the last 3 segments, we've been looking at components of a model. And the 3 components that we've looked at previously is the goal. How do you think about setting goal in a brief therapy Ericksonian perspective? The gift wrapping. Once you understand what it is that you want to communicate, how can you present that in a way that makes a simple idea come alive? We looked at some of the tailoring. How can you individualize? Now, once you have a tailored and gift wrap goal, we have one other consideration, which is process. How do you create a dramatic process that makes a goal come alive? When I first visited Milton Erickson in 1973, I was most interested in the technique. I thought therapy was about the techniques that you use, and Erickson was so remarkably creative about the techniques that he invented. But then I gradually understood that he was really unique in his genius about being able to individualize treatment to the uniqueness of the person, and knew how to establish definable goals that would help the person to get into a more adaptive state. When I later reread Erickson, I realized that even more of his genius was in the process. The process of psychotherapy is basically like the stroke of tennis. How you set up, how you intervene, and how you follow through. Every dramatist is thinking in terms of strategic development. Set up, intervene, follow through. It's like a menu. When you go to a restaurant, you have an appetizer, you have an entree, you have a dessert. You have 3 courses. A setup could be using hypnosis. A setup could be accessing motivation. A setup could be seeding a future intervention. A setup could be to develop rapport, to develop connection. And the steps of the setup can be intentionally thought out as those steps build up to a denouement. And the denouement may be the main intervention. Well, the main intervention, it could be hypnosis too. The main intervention could be an anecdote. The main intervention could be a joke. But the power of that intervention is going to be furthered by the way in which there is a setup. Now, it's not only the setup, but it's also the follow-through. And how we follow through is another series of steps that we may begin to think about. We could follow through by using, if you're hypnotically inclined, an amnesia technique. We could follow through by doing ratification, by doing motivation, by offering the person a task, by giving another anecdote, a kind of a process instruction that helps the person to understand how they might in their life utilize the resource that has been developed in the main intervention. We might have a way of doing a fantasy rehearsal of how the person is going to use the accessed resource in their life. So it has been really important in me over my almost 40 years, well, really 40 years, of being a psychologist, and more than that, 45 years of being a psychotherapist, to begin to access and develop my strategic thinking. Here's the goal. What are the steps that I'm going to take that will help to make that simple goal come alive? And then how will I follow through? Now, strategic thinking like that is not the necessity for every therapist. You can be a very good therapist without thinking so strategically and intentionally. But for those of you who are inclined to develop that skill set, there are many ways in which you can do deliberate practice in related fields. And for example, learning to play a strategic game, for example, looking at the strategic development in a movie, in a novel, understanding what does a dramatist do to develop a series of steps and then come to a landing point and then do something that creates a satisfying ending. So 3-step process: set up, intervene, follow through. Pre-suggest, suggest, post-suggest. Enter, offer, exit. And those of you who are so disposed, you can begin to practice those 3 steps and see you can use this 5-minute tip to be a better psychotherapist. This is Jeff Zeig, Phoenix, Arizona, at the Milton Erickson Foundation. Thank you very much.